Sales of alcohol have surged during the COVID-19 outbreak when bars are closed and people are staying at home.
That time spent with family members can also provide red flags for parents about a child who may be struggling with alcohol or drugs. Dr. Joseph Lee, the medical director of the Youth Continuum of Hazelden Betty Ford in Plymouth, is live on Skype to talk about this problem. Dr. Lee, thanks so much for being with us today.
Thanks for having me.
Let's talk about some of these red flags that parents should be looking for, because is there value right now in the fact that everybody in the same house, you might be able to keep a closer eye on things?
Well, as you've said, historically, in times of economic crisis, use of substances and mental health problems skyrocket. And what we see in a lot of families is that parents and family members are coming face to face with the sheer power and the gravity of a loved one's addiction. And that goes for young people as well. So we see young people, for example, who've used every stash of pills in their home, who drink all the liquor and alcohol in the house within a span of days, who overdose within the home, who are using inhalants or using different kinds of chemicals they normally wouldn't use to get high. And people are scared, and I think they feel stuck. On the one hand, they don't want to leave their house, and they shouldn't if they don't have to. On the other hand, they're seeing maybe for the first time that their loved ones really need help.
So what signs should we be looking for in our kids if this is something that we're concerned about?
Well, I think the signs are actually more easy to see than ever before, because you're seeing people go through so many substances, so much substance use at one time. And so I think people can see it. It's daily drinking, daily use. We have kids who love their family members, but the power of addiction is something that's very impressive, even in these difficult times. We have young people who, for example, will leave the house to go meet with dealers or other people to use, knowing full well that there may be grandparents or other people in the home that are exposed. And due to the power of addiction, they're not thinking about those things. And so parents see it firsthand. I think the fear is they don't really know where to turn for help.
Tell us about the treatments. What kind of options are available to help if we have a young, this is a crazy time when it comes to getting any sort of treatment, right?
It is. What we've done, and we've built this for a couple of years, we've launched it this year, maybe faster than we've wanted it to, but we have a privacy law compliant virtual health hub, and it's called Recovery Go. And we also have a number of apps. And so we can do virtual mental health meetings, virtual psychiatric visits. We have a virtual IOP, that's an intensive outpatient care for people who need it. So there's actually a fairly soft on-ramp for people who are just curious. There are a lot of people across America right now who are also on the warning zone, and they probably would have had greater addiction, but that was stalled by work or athletics or some kind of schedule. And those scheduling devices are no longer in place. And so the using is starting to get out of hand. And we find that a lot of people can get help just by contacting us and starting with some virtual services. And then those people who do need more help, who do have withdrawal, suicidality, more acute mental health issues, often come to a residential site where we have, I think, the best we can do in terms of screening, temperatures, doing all the checks to make sure that people don't get infected.
Good reminder that what we're feeling too, our kids are feeling just as much. Dr. Lee, thank you so much.
You can get more information on addiction and treatment from Hazelden Betty Ford. We have those resources the doctor talked about at WCCO.com/links.